You know, plastic surgery is often thought to be just for women, but that's not so. Dr. George Marosan of Bellevue plastic surgeon says about 10% of all patients nationwide are now men. And the two most popular procedures are chest reduction and liposuction. Welcome back, Dr. Marosan. That's good to have you here.
Thank you.
So, #1 surgery for men is lipo, is that right?
It's lipo, and still men a small percentage of patients that get liposuction compared to women. According to the last statistics of the Aesthetic Society, there were over 400,000 liposuctions done on women and only about 60,000 done in men. But the most common area for men is the midsection.
In fact, let's take a look at a before and after. You can see kind of what we would do here. So we're looking, this is, I assume, a before.
Yes. This is after. So this is actually a young man in his 30s who, came in and was complaining, also with his chest, but complaining about his girth and this is just lipo of his abdomen and also his back. I was a little bit discouraged with him. I told him that he probably won't get a perfect result because he already had a little bit of internal fat as well and fullness, but he did actually pretty well.
Can't you build in a six-pack? No?
You can. I think that's changing too, so more people now come in that really they not have as much fat, but they really want abdominal etching, so they want the six-pack.
Really?
So,
you can
yeah,
do that?
So we can do that.
What's the cost for like this particular lipo procedure on a guy?
Well, the surgical cost is about $5,000 to do the whole midsection, the front, the back. I do the back. I do the so-called love handles that nobody loves.
Right.
So,
and is it more difficult for men or about the same?
Men are a lot tougher than women. They tend to be more fibrous. It's so I always use the ultrasound on men to melt the fat, and in women it's not always necessary. Yeah, a little bit softer.
Let me ask you. So you talked about love handles, which I know guys always are worried about. What about guys that got the beer belly? Can you get rid of the beer belly?
Unfortunately, it's not treated with liposuction.
You got to cut back on the beer before you get rid of the beer.
Yeah, or change brands.
Yeah.
That's really fat that's intra-abdominal, and that's a big fat apron that everybody has, but some people have more than others, and that pushes things out. So that's not treated with liposuction. That's done mainly with diet, exercise.
So basically diet, exercise, and then the last bit of fat that's there, you may be able to do something with.
You can reduce that, right.
Let's talk about the chest for a minute, because I'm looking at it a before and after, because a lot of guys are self-conscious about their chest area, and you're able to do some help there. Here's the look before.
Yes, this is the type of guy, who would probably not take his shirt off in public, and because
guys call these man breasts. I mean,
right.
That's bottom line. Yeah.
So usually. Yeah,
there's the
and
after.
And this is after, just with liposuction only, with the ultrasonic liposuction. Obviously, he's still, he's a 6'2", 270 pounds.
He's a big guy.
So he's a big guy. Still, some other areas that would have needed to be.
But you say you actually, in doing the surgery, he can go back with it. He went back to work within a week.
Yes. This type of surgery is. I'm surprised too how little discomfort they have afterwards, because I know how hard I work with some of these. But
yeah. And how long before you completely heal? So once you've had the procedure,
it can take 3 to 6 months really to get back to normal sensation and not feel numbness and.
And again, the cost for the chest procedure, I assume
it's
a little less.
It's less. It's about $3,400. Yeah,
Chris is actually on the phone with us. Chris, you had both the procedures done. Why? Why'd you do that?
Well, I figured as long as I was doing the chest, I might as well have the the love handles done at the same time.
And explain your experience. How was it?
Overall, it's been actually a great experience. I've thought about doing this for a number of years, and I've gotten really close a few times to scheduling the appointment, getting in there and doing sort of my analysis, I guess, if you will, of what Dr. Marosan's able to do, and shied away from it a few times. And I just finally, this last 6 months, I've been working out really hard and trying to do everything that I could, eat right. I was running or walking at least 6 days a week, and just everything was going great. But I just couldn't lose weight in the areas of my chest or in my, as you mentioned, love handle section, and it's always been that way for me. So I guess I made it there out of frustration.
So how long before Chris sees the results, Dr. Marosan?
Well, I see it right after I'm done with him on the operating room table because he looks the best. And then there's some swelling.
So it
that
comes
happens,
back up a little bit while it heals.
And we use a compression garment for about 3-4 weeks that they wear under their clothes. And in about a month to 3 months, he'll see most improvement, and then there's more subtle improvement over the next 3 months after that. So what he has at 6 months is what he'll end up looking. So,
Chrissy, what are you hoping to look for? What are you hoping to get?
I'd just like to look better. I don't see any reason why you should feel bad about looking better. So I guess I'm going into my 40s, giving myself as much of a fighting chance as I can.
Great. Well, congratulations. Hope all goes well with you, Dr. Marosan. Always great to talk to you.
Nice talking to you.
All right, we'll be right back.
Okay.
That's